Omicron variant is something that many hospitals across the country are keeping their eyes on, including Roper St. Francis Healthcare here in Charleston. Today, I talked with the CEO of Roper St. Francis Healthcare, Dr. Jeffrey DiLisi, for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Dr. Jeffrey DiLisi, welcome to the award-winning Quintin's Close-Ups.
Great. Thank you so much for having me. I'm excited to be here.
Oh, likewise. Obviously, you are the CEO of Roper St. Francis here, really around Charleston. I'm nearby here on off of St. Philip Street here. But yeah, I know that you all are extremely busy, particularly with COVID-19, and now with the Omicron that's going on as far as the variant. According to scientists, this B11529, the Omicron or Omicron variant, is newly identified strain of the coronavirus with 30 plus different mutations in the COVID-19 spike protein, which makes the process of it, as far as the transmission, very easier. Where are you with this in your mind?
Yeah, well, I think, a couple things. First, it's not, I think it's not surprising that we're seeing additional variants. I think this is something we've known about COVID, that it continues to mutate. We continue to see new variants. I think it's not even that surprising that we're seeing the spread happen as quickly as we have. I think it's too early to know right now what this all means exactly, right? I think it seems to be pretty easily transmissible, and I think there are some early signs that show still vaccination and getting boosters is the most important defense against this. And even if you would contract this kind of virus, the chances of you having a severe illness or hospitalization are pretty low if you've had the vaccine or you've gotten the booster. So it's a time really, again, to just encourage everyone, if you have not been vaccinated, get vaccinated. If you were vaccinated more than 6 months ago, please get the booster. It's really important because what we do know is that for people that aren't properly protected, COVID can make you really sick, and we don't want people to get really sick. We want them to be well, and if you get COVID, that it's a mild disease and not anything serious.
And I failed to mention this, Doc, in the beginning of the interview, but obviously you're the first physician to be named the CEO of Roper St. Francis Healthcare. How would Roper sequence this particular variant?
Well, I mean, how in terms of genetic sequencing the variant?
Yes,
yeah. So we send out various samples that come through. We can send them to the state lab or other organizations to get sequencing. We wouldn't necessarily, sequence every single test, but we certainly have the ability to do that if needed.
What is that sequencing capacity here in Charleston County, per se?
I know MUSC is doing some sequencing, but again, when you talk about the sequencing, really, what all of us in healthcare are about is treating the patient, right? So it doesn't matter really whether you have Delta or Omicron or any of the other previous strains of COVID. The issue is you have COVID, and you got to take care of the patient, and you have to look at their symptoms. And really, it's about symptom management. Omicron is going to come, right? It's spreading. I know. I read an article even yesterday that one country was tracking people real closely, and they've stopped it because they said, well, it's here now. It is what it is. You treat the symptoms. You're not going to treat Omicron any differently than you treated Delta or any of the other variants. If people need, help with oxygenation or breathing, you're going to get them that help. And so the variant isn't, the sequencing isn't as important for the treatment of patients.
And that leads me to my next question, Doc. How do you think this variant will clinically behave itself?
Well, again, I think it's a little too early to tell, right? So, it's been a very fast-moving week and a half with this variant, right? So this was only announced last week, right before Thanksgiving. Now we've seen it spread kind of around the globe very quickly. But as we know from the previous variants of COVID, right, people get sick, and then it's about a week to 2 weeks later that you sort of see what the real effects are. Do they get really ill or not? So we're kind of right entering that, sort of portion of time where I think we're going to get a better idea of how sick do people get from this, how well do the vaccines protect against severe illness and hospitalization. So it's a little early to tell that. I think we're going to have a lot more answers here, even in the next 2 weeks.
Yep. Okay. How would the vaccines need to be adjusted for this variant?
Yeah, well, so the vaccines, the vaccine makers have processes and protocols to look at any of these mutations of the proteins that are on the virus. And so, I think one of the things that they're looking at is how would they tweak the vaccine to really address this variant. But just as importantly, we're still trying to figure out how well do the vaccines that we already have work against it, right? Because if it's already working really well, maybe you don't need a different vaccine for it or not. One of the things that, I think we're seeing about COVID is it's sort of like the flu, right? Everybody, or a lot of people get flu shots. Just because you get a flu shot doesn't mean you're not going to get the flu. But a lot of times, just because you had that flu shot means that if you got the flu, that flu might not be as bad. And we were able to live life pretty normally with the flu around. And so if we can get to a point where people are really vaccinated and, if COVID is a mild illness, kind of a cold for a couple days, maybe that's not as big of a deal. And you don't have to, again, chase every one of these variants necessarily. So, again, we'll see what happens here over the next couple of weeks as this develops.
And with this variant, Doc, how would you, as the Roper Hospital, Roper St. Francis Healthcare, that is, check for bed usage?
Well, we check for bed usage every day, whether we're in a surge or not. So we're constantly monitoring our beds, seeing what staff we need to add or not add based on the numbers going up. But as of now, we haven't seen any surge in our capacity due to the Omicron variant.
And would Roper St. Francis Healthcare have to limit non-essential and non-urgent hospital procedures in situations where the hospital has less than, say, 10% staff bed capacity?
So, it's a very complicated question and just based on various scenarios. I will tell you that when you talk about non-essential, that's a really hard thing to define. And what I always tell people is if somebody needs a knee replacement, right, is that essential? Is it not essential? Well, the person that needs the knee replacement sitting at home, they probably can't walk because they're having so much pain from their knee. And that means maybe they're not as active as they could be. They might be gaining weight. The weight gain could cause other comorbidities and heart problems. And so is it really not essential? That's hard to say. And so, our goal is always to provide everybody with the care that they need. We're not in the business of doing any kind of, I'll say, truly non-essential surgeries, things like plastic surgery or liposuction, things like that. We don't do things like that. We do things for people that need care. And I don't think there's any surgeries happening in our hospital that I would call, they're all essential to that patient. Sometimes you have to prioritize based on bed capacity, but we try not to get in that situation if need be.
What is the inpatient and outpatient bed capacity right now?
We have plenty of beds at the moment. There's no issues with bed capacity right now.
And what equipment is available just in case this variant, God forbid, spikes or whatnot?
Well, again, the equipment needed to take care of the Omicron variant, it's no different than the other variants we've seen of COVID. And so, you need ventilators, high flow oxygen machines, and we've got plenty of them in house. We took care of a record number of patients with the Delta variant with that surge in September. And so we feel very prepared to take care of whatever comes through the door.
How many booster shots has your hospital actually administered over the past 6 weeks?
Oh gosh, you know what? I don't know the exact number of the booster shots over the last 6 weeks. The good news is we've seen good demand. I think we've seen good uptake from our staff. But again, really, really important that people go out. If you were vaccinated, it's been more than 6 months, please get the booster. It seems the data is very compelling that the booster certainly helps prevent Delta and serious illness from the Delta variant. But even there's early signs that it will help with Omicron as well.
How many positive COVID-19 tests per week does Roper St. Francis Healthcare really sequence roughly?
How many positive? I mean, you know what? It goes up and down based on the surgeries and whatnot. I mean, it's been high, it's been lower. Right now, it's a little bit lower. It just depends on where we're at. We're at a little bit of a lull right now. You see other states around the country having much higher positivity percentages. So we'll see what happens. I think one of the nice things about South Carolina and the Charleston weather right now is it's as you're outside today, it's about 70 degrees, really nice. So people don't need to necessarily be inside. They can be outside. And we know definitively that it's safer to be outside with people than to be inside unmasked in a room. And you're just at higher risk at that point. So our climate right now is a huge advantage for us because people aren't forced to be inside with each other quite as much. But again, we'll see. It will get a little bit colder here, and I think people will return to a little bit more inside gatherings, and we could see another spike. I think in the early part of 2022.
Wow. Would it be possible, Doc, for Roper St. Francis Healthcare to report whether positive cases are vaccinated versus not vaccinated, and are you actually collecting that type of data?
Yeah. Well, during the Delta surge, we reported that out on our social media feeds every day. We showed the number of hospitalizations, and we showed the number that were vaccinated and unvaccinated. And what I can tell you is that it was very consistent. About 85 to 90% of the patients that were hospitalized were unvaccinated. It was very, very clear that this was a disease of unvaccinated patients. And in fact, I was looking at a diagram, I think from the University of Michigan, and they were showing similar data on their cases right now. Michigan is having a surge, and they had vaccinated, unvaccinated, and then they put a little mark on, they had some sort of figurine for each person that had been hospitalized, and then they had another mark that signified whether the patient was older than 65 or had other serious comorbidities. And I want to say it was, again, about 85% were unvaccinated, and then about 85% of the smaller number that were vaccinated had, were either advanced age or other significant comorbidities. So again, this goes to, if you get the vaccine, if you get the booster, and you're otherwise kind of young and healthy, it's extraordinarily unlikely that you get sick from COVID requiring hospitalization and or leading to death. And if you don't get it, you're at risk for that. And it's kind of as simple as that, which, unfortunately our team and our health system and our colleagues around the Charleston area and around the country have seen way too many deaths amongst young people simply because they didn't get vaccinated.
So sad. Okay, and so with the number of people coming into your hospital system, how many of those people actually have underlying conditions?
Well, most people coming into hospitals have some underlying condition. Well, in general, patients that get hospitalized, most of them probably have underlying conditions, right? It's you have some sort of comorbidities, and then you get another illness, and that leads you to the hospitalization. But what has been very interesting about COVID is we have seen significant populations of people that were younger and otherwise healthy get hospitalized, and some of them unfortunately have died, even though they really had very little underlying issues. Which again goes to why it's so important to get vaccinated.
Yes, sir. And speaking of which, what is the current vaccination rate here, say in Charleston County?
Well, I think across the state, I want to say it's somewhere between 50 and 60%. I don't know what the exact rate is in Charleston County. We've been very happy with our own vaccination rate in our hospital, and getting everybody up to speed with that has been something that we're really proud of as an organization.
And what is that rate inside your hospital?
Yeah. So we really have everybody that works for us now has been vaccinated or had a kind of medical or religious exemption. So, everybody's vaccinated or had a legitimate reason to not be vaccinated.
And what is that percentage of those people that say, hey, I got it exempt because of religion or whatever?
It was pretty small. I mean, most people got the shot.
Okay. And what current data, Doc, does Roper St. Francis Healthcare have on natural immunity?
It's hard to say. Certainly, I wouldn't say that was something that just Roper could study and say, hey, this is what the truth is about natural immunity. That's going to take much, much larger national studies run by, I would say, some of the very largest health systems in the country or academic medical centers in the country. I think, the verdict is still out on exactly what natural immunity means. It certainly sounds like if you've been infected, you have some protection. The question is how strong and for how long. And that I don't think we fully understand yet, which is why the CDC recommends that even if you were infected, that you still go get the vaccine. And that is certainly what you should be doing. So again, we encourage everybody, whether infected or not, to get the vaccine.
And if someone who has had COVID sees their antibody levels drop, would a boost infection be ideal?
Would a booster shot, you mean?
Yes, so an infection.
Yeah,
yes.
It would be. It just depends what you're calling it, right? If you were infected and then you get the initial series of vaccines, the way the recommendations for the shots are, if you're getting your first COVID shot, it's a series of 2 shots, right? 3 weeks apart. And then 6 months after that, you would get a booster. So we would just encourage anybody, even if infected, to follow the CDC's guidelines for vaccination.
How many hospitalized COVID-19 patients are there currently at Roper St. Francis?
Oh gosh, I don't know the number today. It was a little bit. I think it was around 20 earlier this week. So it's been pretty low in general.
And let me ask you: do you have any COVID patients currently being treated in your ICU?
You know what? I believe we have a few, but again, the numbers are very low right now.
Yes, sir. And have the numbers for COVID been on their way up since mid-November?
You know, it's been pretty flat at the moment, right? So we saw a huge spike and got upwards of around 200 patients in our hospital with COVID in September. That number has come down, came down over the month of October. And we've been in a little bit of a steady state over the last, call it couple weeks.
Yes, sir. Oh, yeah, absolutely. Sorry about the delay here. But
that's okay.
And let me ask you, would you like to see, Dr. DiLisi, a traditional vaccine such as the Covaxin?
A traditional vaccine like the what?
The Covaxin.
I guess I don't understand what you mean by traditional vaccine. Like the flu vaccine, you mean, or?
Well, like a traditional vaccine, like they have like in India.
Oh, you know what? I have told people on multiple occasions. I think one of the great blessings and almost miracles that we've seen in this country is the development of this vaccine as quickly as it happened. I mean, COVID hit in March of 2020, and by December of 2020, we had a vaccine that has reduced the amount of complications and death in this country for those that have received the vaccine. And even the fact that we've had some windows of time this year where we've been able to be unmasked with our friends and family and loved one in inside spaces and felt very safe is because of this vaccine that has been developed. So, I would love for COVID to go away, but I feel truly, I think it's an amazing miracle of science that we have a vaccine that works as well as it does, and we know prevents those serious complications and death.
And so, with COVID in your mind, is it still a 99.9 survival rate?
So it is a 99.9 survival rate for, I don't know exactly what the survival rate is, and I don't know where that number comes from exactly. The truth of the matter is when you look at, I will say this, if you go back 3 years ago, okay, despite the fact that a lot of people get the flu shot, every year we would see patients that were really sick with the flu that would come into the hospital. Some would die. Some would die of the flu, even though they got the flu vaccine. Now, most people that would come in, almost all of them were really older people. Okay. But, I'm a physician. I practiced as a doctor for a long time. And myself and all of my doctor colleagues have all seen the occasional patient that was young, 30s, 40s, that just got a horrible case of the flu and might come in and not survive. So we'd all seen it, but it was extraordinarily rare. Wow. And then COVID hit. And all of a sudden, we saw lots of people in their 40s, 30s, 20s, 50s hospitalized on ventilators, some of them dying with no other medical problems. And it's so much different than the flu and so much more serious and deadly than the flu. And we continued to see that with the Delta variant because not everyone got vaccinated. We did not see that pattern of illness in the unvaccinated. In fact, what I would tell you, and there was a really good article from McKinsey that you can look up online, where they talked about hospitalization and sort of death rates amongst in peak flu seasons and amongst vaccinated patients. And honestly, vaccinated patients were getting less sick from COVID than people were in worse flu seasons. So it was safer to have a COVID vaccine. There was less problems related to COVID if you got a COVID vaccine than if you got a flu vaccine in bad flu season. So that's how good that vaccine was. But if you were unvaccinated, the risk of illness and the risk of death was like 30 times higher than the worst flu season. So it just gives you an idea. This is not the flu. If you do not get vaccinated, you are really at high risk for serious complications.
Wow. What antiviral medicines are ideal for COVID?
Yeah. So there's a couple that have just been, are coming out. I think there is a pill from, I believe it's Merck. So we're going to see how that works. There are other studies going on. So, I mean, that's another exciting aspect of this is, we've seen the vaccine part. We're now seeing the antiviral drug part of this come through. There was obviously an infusion, a drug called remdesivir, that we gave to a lot of patients that had, certainly some good clinical effect. But obviously, if again, sort of comparing it to another virus, the flu, we have a medicine called Tamiflu that if you can catch the symptoms really early, you can take the Tamiflu, that works pretty well. So it would be great to have a medicine like that for COVID, where if somebody got symptoms, you could give them a pill for a couple of days and then they'd be, generally okay, and you could keep them out of the hospital. So we are all certainly rooting for that kind of therapeutic to work like that, and that we have great access to it and we can get it to our patients in a timely manner. So it's exciting. There's some good things coming out on the horizon.
And, I talked to a lot of people who, obviously survived COVID, and they say, hey, I'm still having some long-lasting issues with COVID. What are those problems that you're hearing?
Yeah, I mean, long COVID is a real issue, right? It's another reason why you want to get vaccinated so that you don't experience that. But, I mean, we've heard of people with neurologic issues, kind of chronic fatigue, chronic breathing problems. So there's certainly those impacts are out there. And just again, it all goes back to vaccination. It's the best thing you could do. It's the simplest thing. It's a 2-shot series. People sometimes feel some of the side effects on the day after you get the shot. Might feel a little fatigued, but it's nothing that sitting on your couch for a couple hours and watching some TV won't get you through. And then you're protected, which is great.
Yes, sir. Well, let me turn to some developing news, and it's a little bit of sad news around here in downtown Charleston, as Roper St. Francis Hospital is an icon around here. But Roper Hospital, according to the Post-Corey, has announced plans to move off this peninsula, citing flooding as an ongoing concern. You all say you need a new building that can better sustain the threats of flooding, potential earthquakes, and hurricanes. What is the current condition of the building right now that you all are sitting in?
Building is fine, but Roper Hospital was built in the 1940s, right? So it's 80 years old, and I think just like any building that's 80 years old, we want to have a first class. It's a first class hospital, but we want the look of the first class hospital to match the history of our organization and the quality of care that we're delivering to all of our patients. So we really had to go through a thorough process of evaluating our options. Flooding was not the only factor by any stretch of the imagination that led to this decision. Traffic down in the peninsula, and really one of the things that we've talked a lot about is access for our patients. So we unveiled a new 2030 strategic plan, and our vision is providing convenient, high-value, clinically integrated care to all. And convenience is the first word, and to me, it's such a powerful one. How do we provide convenient care? And what's interesting about the history of Roper Hospital, when it first opened in the 1840s, 1850s at the corner of Queen and Logan Street, that location was probably the center of Charleston, right? Charleston was the peninsula in the 1840s and 1850s, and the founders put a hospital in the middle of Charleston. But as we know, Charleston has undergone explosive growth, right? Charleston isn't just the peninsula anymore. Charleston is James Island. Charleston is Mount Pleasant. Charleston's Daniel Island. It's Somerville. It's Berkeley County. It's a huge metropolitan area with close to 850,000 people. And the center of those 850,000 people, it's not next to the ocean, right? It's somewhere up the peninsula, up the neck. And so we think we have a tremendous opportunity to serve all 850,000 people in the Charleston metro area by making that hospital more central and more convenient to everybody. And if we can make the hospital, which is sort of our hub, more convenient for that entire area, we think we've done a great thing for the patients in our community.
And I hope I can get you back on in 2022 to talk about that strategic planning in depth. But what location in the area would be ideal for your new building?
Yeah, we're still evaluating various land options, but again, I think somewhere up the neck, what we've said kind of on the record is somewhere inside of 526 to us makes sense. We're kind of looking at options around that.
And what else would you be able to do in a new building that you really can't do right now in the current building?
Well, I would say there's nothing we'd be able to do in a new building that we can't do in this one. It's just, it's time for Roper Hospital to have a major facelift or to rebuild it. And when we looked at those options, the major reconstruction on Roper Hospital was going to cost almost as much. And one of the things that really concerned us about that was the disruption to patient care while that reconstruction was going on. So you can imagine, I wouldn't want my mother, my wife, or anyone in my family to be, operated on and then have jackhammering going on at the same time while they're trying to recover from surgery. And so one of the nice options with this is to really be able to build a new hospital and shut the lights off on Roper downtown on one day and then turn it on at the new location the next day without real disruption to patient care. But, look, we are going to build a new hospital, and while we could do all the same, we were going to be able to do all the same things in the new hospital that we can do in the current location. Of course, we're going to be looking at what do procedures look like in 2030 and how big do the ORs need to be to accommodate new equipment, so that not that we can't do them at current Roper Hospital, but we can do them, with enough space for the team, the technology and whatnot, so that it's really, we provide a first-class patient experience.
And isn't this an interesting move, considering how the medical district is at the heart of the city of Charleston's flooding and infrastructure resilience and strategy?
I think, again, when we were evaluating this option from the perspective of Roper Hospital and our health system, right? And we looked at a lot of different things, from, again, the disruption to patients, as we talked about, from traffic, from flooding, and then, as I said, most importantly, who are the patients that we're serving and where do they live? And some of those patients live in the peninsula, and we are committed to continuing to provide services here on the peninsula so that we can take care of them. But we think because Roper is our tertiary hub, where we do the most complex cases that we do as a health system, things like bypass surgery and valve replacements, that hub is better put in the middle of the Charleston metropolitan area and not just here at the tip of the peninsula. It's going to make it more accessible for more people in Charleston than it is now.
I'm probably going ahead of myself, but in that strategic plan, where do you all see most patients moving to in the next 5 years?
Well, I think where they're moving now, right? There's so much housing developments going on up in Berkeley County, and places like Carnes Crossing. More housing developments are opening up on Johns Island, but the growth in Charleston, the peninsula is I guess waterlogged, right? You can't put up new housing developments necessarily in the peninsula. There's obviously some apartment growth, but the real housing starts are further up in Berkeley County, Somerville, and those kinds of places. So as more people move to those locations, the center of Charleston kind of moves up, closer to that 26.5, 26 intersection.
But is this move because of the impact of overdevelopment in downtown Charleston?
No, I think I just gave you the reasons, right? It's there are multiple factors that went into it. Again, anywhere from the disruption to patients, traffic, some of these flooding issues, and most importantly, serving our patients and where's the best place to serve our patients.
Once Roper Hospital St. Francis, obviously healthcare, moves off the peninsula, do you expect MUSC to use that space for parking?
Well, there's a lot of discussions right now. We own the land, and so at some point we're going to need to make a decision on what to do with that land. We certainly have a great relationship with MUSC, and they're certainly somebody we're talking to about it.
Okay. Well, and by the way, let me talk to you. As obviously you're the new CEO of Roper St. Francis Healthcare, what has it been like to be in that position?
It's been tremendous. I was really attracted to this opportunity. It is a mission-focused organization. Our mission is healing all people with compassion, faith, and excellence, and that is something that has resonated with me from day one, and it's something that I felt in the hallways of every place that we serve our patients. I think it's really ingrained in the people that work here, and I just feel truly fortunate. I've been surrounded by a tremendous leadership team. I think I've been lucky to have some people that have moved from my prior job and have come down to continue to work with me. There's some people here that have been around for a long time that have just become truly trusted colleagues in a short amount of time. And we brought in some new people that have just made a difference from day one. And then on top of that, I've got a great board of directors, just a tremendous group of people, physicians and community members that have been so supportive, as well as, Roper St. Francis Healthcare is a joint venture between Bon Secours Mercy Health and the Medical Society of South Carolina. And the leaders from both of those organizations have just been instrumental and so supportive of me and the organization. So when you get that many people kind of all working together and all on the same page, it makes it a lot of fun to get up in the morning and come to work. So I'm a real happy person and just love being part of this Charleston community.
That is just so amazing. Well, Dr. Jeffrey DiLisi, thank you so much for your time. And again, welcome to the award-winning Quintin's Close-Ups.
Thank you so much for having me. Great to speak with you. Look, hope we can do it again.
Yes, sir. Absolutely.